Coast. Welcome to the Pathways RTC February 3rd webinar, Creating Organizations that Address the Needs of Youth, Families, and Staff Who Have Experienced Trauma. Before we begin, I'm John Osowski, and I am the Dissemination Manager for Pathways RTC, and I'd like to just go over a few housekeeping tips for you all that are attending the webinar. It may be helpful to move any electronic handheld devices away from your computer and speakers. Please close all other applications and streaming music and video to ensure the best connectivity to this webinar. Check your settings in the audio pane if you're experiencing any audio problems. And during the presentation, you can send questions to the webinar organizer, but these will be held till the end. So I will be taking notes, and we're going to have about 10 to 15 minutes or more at the end to answer all of your questions. Audience members will be muted during the webinar just because there's quite a few of you and there's only a few of us. A recording of this webinar, as always, will be available online from the Pathways RTC website at the link shown below. So the slides and the entire recording will be available for later in case you miss it or you'd like to review. So without any further ado, I'd like to introduce our esteemed panelists. We have Dr. Jane Halliday with us today and Bree Maselli, and I'm just going to let them say a couple of words of introduction about themselves, and then we can begin. So Dr. Halliday, if you'd like to begin.
Thank you, John. I'm, as you said, Jane Halliday Goldman. I'm from the National Center for Child Traumatic Stress at UCLA, and we are part of the National Child Traumatic Stress Network. I'm the director of the Service Systems Program, so that means that I'm involved in projects that the network is doing related to creating organizations and systems like child welfare, juvenile justice, healthcare, schools, mental health, law enforcement that are trauma-informed.
Great. And Bree, if you wouldn't mind providing some words of introduction.
Hi, my name is Bree Maselli, and I am the Director of Technical Assistance and Evaluation with Youth M.O.V.E. National. And I come to this work as a trauma survivor myself. And at my role with Youth M.O.V.E. National, I just work with communities to help engage young adults and youth in the creation of systems and the development of trauma-informed organizations.
Great. Thank you, Bree. And we're going to begin with the National Child Traumatic Stress Network.
Thank you. And I thought I'd start by giving you a little bit of a background on the National Child Traumatic Stress Network. I'll probably refer to it as the NCTSN from here on out. Some of you may be familiar with it, but I think it might be a great place for a lot of really good free resources. So I want to just tell you a little bit about how we develop our knowledge and our products, and a little bit more about what we do. And then I'm going to talk a little bit about our approach to creating trauma-informed organizations and where that comes from. Some areas to look for when you do a trauma-informed organizational assessment, and some tools. And I'm really grateful that Bree is able to, that we're able to do this webinar together, because she's done some really wonderful work in Maine and nationwide on the issue. So I'm looking forward to that. So the mission of the NCTSN is to raise the standard of care and improve access to services for children, their families, and communities who have been traumatized throughout the United States. I think I'm going to start with just a little bit of background. Next slide, please. So the NCTSN was established by Congress in 2000 as part of the Children's Health Act, with the mission, as I just said, of raising the standard of care and increasing access to services. I'm at the coordinating center of the NCTSN, the National Child Traumatic Stress Center, and I'm here at UCLA, but we're a collaborative between Duke University and UCLA. And I think we're really unique because our grantees are very diverse. They include hospitals, universities, community-based programs that are involved in training, delivering services, developing products, collecting data, evaluating practices and products, and and interventions, and also public policy and awareness efforts. So that means that when we create a product or a practice, we do that within a collaborative group of people who are from all over the country, in rural settings, urban settings. So a call would include researchers, people who've developed a lot of these interventions, consumers, family members, frontline staff, administrators, and clinicians. So we really try to be kind of an immediate bridge between research and practice, and really try to create tools that are useful for people who are actually out there doing this work. Next slide, please. This is just a map of where our centers are located. When we first started, we had 17 funded centers in 2001, and we now have 79. But our centers who have been funded in the past are still an important part of what we do and are still really active in our groups. So we have, in addition, we have over 100 affiliate centers and individuals. And as I said, they come from all sorts of settings and different types of programs. We've been in 43 states. Next slide, please. So some of the things that the NCTSN does to accomplish the mission that I mentioned, we provide clinical services. We develop and disseminate new interventions and resource materials. We do a lot of education and training programs. We collaborate with established systems of care. So we have really close partners and collaborators within all of the systems I mentioned before: child welfare, juvenile justice, healthcare, etc., schools. So children and families benefit from the improvement of evidence-based treatments and the expansion of educational opportunities and the development of community and national collaborative partnerships. And we really try to disseminate these resources as widely as we can, which is why I'm enjoying the opportunity to be talking with you today. Next slide. And I wanted to just let you know, if you haven't found our resources yet, this is where you'll find them. I'm going to mention some things, and these are the two places within our website where they'll be found. First, we have our big NCTSN website at www.nctsn.org. There's a ton of information about different child trauma types. We have over 300 network products. We have links to other trauma-informed resources. We have a military families knowledge bank. We also have actually a measures review database. So we have screening and assessment tools that are available, and we have reviews of them from different cultures if they've been tested or used within different cultures and different communities. And we have information in Spanish. Now, we also have a learning center, which you can get to from our main webpage, or you can go to the website that's listed there, learn.nctsn.org. You do have to create an account, but it's free. It doesn't take very long to do, just so that we can track who's using our resources and how. And also, we have hundreds of webinars available, and you are able to earn free CE credits. So you can enroll in a speaker series. There are communities of people who facilitate things such as, a training for resource parents that we have, or a training for child welfare workers. So you can find a community of people who can add additional resources. You can train in psychological first aid. There's a lot of resources on that site too. So if you haven't been there, I encourage you to check those out. And I think that's a little bit about my background. I think Bree is going to tell us some more about the Youth M.O.V.E. National.
Thank you. So Youth M.O.V.E. National is a national youth-led organization, and M.O.V.E. stands for Motivating Voices of Experience. And so Youth M.O.V.E. National is a organized group of young adults who have all had systems experience. So we all come to the table with a personal story, and collectively we bring those stories together, unite the voices of individuals across the country in the various systems, and aid as a partner in creating systems change and offering opportunities for empowerment for young people. Next slide, please. So we are a chapter-based network. We have chapters within 37 states, tribes, including the District of Columbia. We have roughly 1,000 youth advocates as part of our membership. Our chapters are multi-system involved youth. So they definitely tap into the various systems in which we provide technical assistance and training to. Most of our work happens within the local network, so we provide guidance directly to our local chapters, as well as utilize their voice to inform any state or national policy. Next slide, please. So we're a youth-driven organization, and each one of our local organized chapters have developed kind of purpose areas in which the young people collectively come together and develop strategies to improve the systems within their local communities and within themselves. And these here are just a few of our chapter purpose areas to really think about how young people are using their voice to connect to organizations and systems to make them better for the next generation. So some of our chapters offer peer networking and pro-social recreational opportunities for a lot of young people that are involved within mental health systems or child welfare. They feel very disconnected from an actual peer group. And so Youth M.O.V.E. chapters are a great place to bring like-minded young people together to feel a part of something locally, as well as a part of something at the national level. Many of our chapters do community involvement and advocacy based on issues and concerns that come up locally for them. We also have a national children's mental health awareness campaign, so young people participate both nationally and locally on developing messaging and bring awareness around mental health and its challenges to help minimize and reduce stigma. Most of our networks participate in several of our youth development opportunities by contributing, creating documents, materials, joining us on webinars, participating in leadership academies, to really help develop their own individual skill for personal development and empowerment, so that then they're able to apply that knowledge to the change that they'd like to see in their community. Many of our chapters are moving into kind of really being a service-driven chapter by providing opportunities for young adult peer-to-peer services that is embedded within mental health agencies or within the service array that's offered within their communities. They're really starting to kind of delve into a movement very similar to that of the family movement or the adult mental health movement. We're really creating this niche and opportunity for young people who feel empowered and have developed a skill set to be able to offer that back in a service workforce way. So those are a few of our focuses of what our chapters do across the country, and at Youth M.O.V.E. National we help them execute these ideas on a local level. So if you'd like to go to the next slide.
Okay, this is Jane again, and I mentioned that I'm the director of the Service Systems Program. And so one of the things that we did a few years back is we brought together folks who are really active in the area of trauma in all different service systems, and we came up with a general definition. I would make the note that we've done a lot of work in specific systems as well. So there are, some things, for example, in juvenile justice, we would look more into issues such as disparity and the environment of care within residential treatment. But this is kind of a general definition, and it really informs the work that I'm going to go into more detail about. This is the definition that we came up with. A trauma-informed child and family service system is one in which all parties involved recognize and respond, so there's a stress on both of those, there's awareness as well as action, to the impact of traumatic stress on those who have contact with the system. And then another really important aspect is that includes children, caregivers, I would add family systems to that, and service providers. Programs and agencies within that system infuse and sustain the trauma awareness and knowledge and skills into their organizational cultures, practices, and policies. They act in collaboration with all of those who are involved with the child, using the best available science to facilitate and support the recovery and resiliency of the child and family. Next slide, please. Then we go into a little bit more detail, and you'll see these are really related to these domains I'm going to talk more about. So I'll just briefly mention that the next part of that definition talks about programs and agencies and service providers within a trauma-informed perspective would screen for trauma exposure and symptoms, use culturally appropriate evidence-based assessment and treatment for traumatic stress and the mental health symptoms that are associated with that. Make resources available to children and families and providers on trauma. Engage in efforts to strengthen the resilience and protective factors of children and families. So it's not only about mental health treatment, it's about all of those factors that make more resilient families. Address parent and caregiver trauma. Emphasize the continuity of care and collaborating between these various systems that treat our families. And this probably shouldn't be last. Often I think we need to start with it, but maintaining an environment of care for staff that addresses and minimizes and treats secondary trauma and increases their resilience. Next slide, please. So we've been doing a lot of work more recently on kind of a more systematic organizational assessment of trauma informedness. And you know, we've toyed with the idea of developing a single tool, but what we found with the organizations that we work with is that there's such a variety in the populations that they treat, in the types of services they provide. You know, they're not all mental health agencies. They also are dealing with families that are experiencing very different types of trauma. So, you know, we found that instead of creating sort of a single tool, and there's already some really good tools out there, we've come up with some buckets or some domains that we think are really essential to look at when you're looking at whether your agency is trauma or your program is trauma informed. So that's really what I'm going to focus on. And those buckets here are, the first one is giant, is screening, assessment, and intervention. We put them in one area because we think that they're extremely interconnected, and that interconnectedness is really important. Strengthening the resilience and protective factors of children and families, trauma competence and awareness, parent and caregiver trauma, continuity of care and collaboration across systems, and secondary traumatic stress. So those are the kind of buckets that we use when we help an organization do an assessment. Now, in addition, there are some lenses that go across all of those domains. One is developmental. You know, all of these things vary depending on the age of the child and the developmental age and stage of the child and the family. There's also a cultural component that goes across all of those domains and is really important to look at. And then I would say, in addition, you know, which is more, I know Bree is going to talk about even more, but engaging families and youth in across all of these domains to be an integral part of this work is also really essential. Next slide, please. So in order, you know, it can be really overwhelming. You know, we have these sort of nice buckets of things you can look at, but there's also, you know, when starting the work of creating a more trauma-informed organization, we always tend to look towards science, so we look towards implementation science as a way to guide this process. This also makes it look a lot less messy than it really is, because, you know, it kind of makes it look like there's an order. You do this and then you do this, when, you know, in actuality it's very iterative. You'll get to the last stage of sustainment, and then you'll find that something isn't going quite right, and you'll have to go back and you know, figure that piece out, and that's really common and can be frustrating, but when you accept as part of the process, I think that that makes it a little bit easier to swallow. I'm going to talk a lot about the exploration phase because I'm going to talk about assessment and information gathering. It's the first stage, but it also informs every other stage, and it really sets the stage for the rest of the work. So the idea is there's an exploration phase where you collect all the information, you kind of lay the groundwork, a preparation phase where you get the buy-in, you identify the tools to help you get there, and you put the plan in place, or you set up the plan, you create the plan, and then in the implementation phase you put the plan into place. And then the sustainment phase is you figure out, you know, how to keep this going, how to maintain it, how to continually assess to make sure you're going where you want to go. Next slide, please. But I also, you know, having said that, just want to make sure, you know, it's frustrating because you do find yourself going back and forth a lot, and that's just a normal part of the process. So as I mentioned, I think organizational assessment is really informs every stage, and is an important part of, I think, of every stage. Besides besides doing the third thing that's, or I guess it's the third thing, which is what we usually think of, identifying those areas that can be improved and things that can be built upon, which is essential in what we think of in terms of assessment, but it does a lot more than that. The process can really engage staff and families, which is absolutely critical for implementing new practices. So when you're out there asking questions and talking about it, you're providing an education about, what a trauma-informed organization can look like. And you're, identifying some things that they're already doing, which allows for a little bit of a de-stressing. And, all of these systems that we work in are overstressed systems, and this can seem overwhelming. And adding a new thing seems impossible, and everyone's heard it before. There's always a new thing. And so, having this conversation can kind of demystify it a little bit and get some more buy-in. The other thing is it's essential to have, trauma champions. We have one site, the Hearts program in Beth Israel in New York City, and they call them trauma doors. So they have people that, when they go to an agency to provide some assistance, they, identify this group of people who really seem to get it, that kind of light up when you talk about trauma. They understand that ways that this might really impact their organization. And those are the folks that are going to help with implementation, but also with sustaining. They can, when you leave an organization or when you're done with this very focused work, they can continue to get together and look at practices and tweak them and provide training opportunities and really be the ones to sustain the work. So that's why even this assessment process informs how these practices will be sustained as well. It identifies differences in the perceptions of the existing practices from administrators, clinicians, staff, and consumers. So you may talk to one group and they may say, "Oh, this is perfect. Everybody is trained in this trauma-informed approach, and so we do this really well." And then you may talk to a consumer or a staff member that has no idea that that this practice exists, and identifying those gaps is a really good way to figure out where some of the important work needs to be done. I mentioned it's an opportunity to increase trauma awareness. When you ask a lot of questions about these different domains, then people, kind of figure out that what their work has to do with trauma. So the other thing is it's really important to get agency buy-in in a pretty widespread way, because it's exactly when you're doing clinical practice and you do a really thorough assessment, you ask about all these areas, and then you never help a child or a family with those areas. It's really frustrating. Same thing in an organization. An assessment is really effective as an implementation tool, but only if the organization is willing and committed and has some resources, not necessarily financial, but some time resources to commit to addressing the results and making the changes. Next slide, please. So I'm going to go into a lot more detail on each of those different areas, but there's a lot of different ways to get at this information. We usually we sort of put it together a little bit at a time. We see what we can get from one group, and then we try to go into more details, and but at the same time try to be efficient so that you're not asking the same questions and getting the same information over and over again. So we often start with interviews with the administrators regarding the policies and the programming and the, what kind of training everybody gets, what are, your general procedures. We review the policies and other organizational literatures, maybe organizational charts. Sometimes there are really interesting practices that have been written about that you can read more about. And then we take that information and then we put together a survey. And there are a lot of existing tools. There are some resources later on in the slides that you can get some links to some of the tools that already exist. But we do a survey of frontline and clinical staff who play a role in the process. And then we follow it up with focus groups that can really kind of tease apart what that information means and answer some questions you have. And we like to do them with clients and with parents regarding their perception of of how these things impact their lives and their healing. And also with staff, we try to do follow-up focus groups with them as well. if this is combined with any training efforts, we like to do pre and post tests, because then you can also evaluate whether they've gained some knowledge or maybe changed some attitudes. So for example, some of our trauma trainings have pre and post tests that are embedded within the training. So that's something an agency can use. And that also helps with sustaining, because if you can show that there have been some gains in those areas, then you might be able to get some more funding to continue those practices. It's also important to take a step back and look at the other community resources that exist. For example, maybe you're at a child organization that doesn't have the capacity to treat parents who've experienced trauma, but maybe you can develop a really close partnership with an agency that does. So what other resources are available, and also what other community resources can really help support the families that you're serving. Talking to other agencies and community members about their perception of the agency also gives you a huge amount of information. How is this looked at outside of the agency? How is and maybe why? And that can help you also figure out some possible changes. And finally, it also could be useful to have a standardized measure or two in there. One that we like to use for secondary trauma is the ProQual, and that looks at secondary traumatic stress, burnout, and compassion satisfaction. And sometimes having that goal of increasing compassion satisfaction can sound a lot more appealing to an agency rather than, because it looks at the positive and how to increase it. Okay, next slide, please. So the first domain I mentioned is screening, assessment, and intervention. I should also say, I know I'm just kind of capturing the tip of the iceberg with all of these. There are a lot of resources. We have some, and there's others available, so you'll have our contact information as well. Please don't hesitate if you have a specific question about an area, how to get more information about it. Then you can figure that you can contact me, and I can direct you to a resource that might be useful. So this first domain of screening, and assessment, and intervention, we usually start by trying to map that pathway. So how does, when someone comes into the agency, how do you first start to ask about trauma? And then how does that lead into an assessment? What tools are used, or what is the process? Are there any specific measures that are used, and what do they include? Let's see, how are the measures used, who administers them, and how are people trained to administer them? And do they receive supervision, if they, for example, are a frontline staff who, maybe does not usually get clinical supervision, but if they're asking these kind of questions, maybe exposed to stories that they deserve some clinical supervision to support. Are these measures culturally appropriate? Are they in the right languages? Next slide, please. And then how do you go from that really comprehensive assessment to an intervention? It's important that assessment includes a lot of different things, helps to build the trauma history profile of the kinds of events that have impacted the child, as well as all of the environmental considerations that are, and the things that happen afterwards. So it's not just the one event, or most likely multiple events that have impacted a child or youth, but then also, that has an impact on the caregiver, which has an impact on the way the caregiver parents. It might result in a change of home. Maybe the whole family moves, or maybe they're placed elsewhere. Maybe they have to change schools. Maybe there's a changes to their body if it's a medical trauma. I mean, whatever happened, also dealing with those changes is significant. And then sometimes a lot of the behaviors that we see that people are seeking help for are due to how they're reminded of that event. So the trauma reminders also have a significant impact. So all of those things need to be, put together in this really comprehensive assessment. And then, what happens so often in an agency is that we fill out this assessment, over a few weeks' time, and then because we're required to, and then it goes into a folder, and it really doesn't inform case planning and intervention, but it really needs to. does the agency have interventions that are appropriate for the age groups that it sees and that are trauma focused? Also, is there a trauma-informed safety plan in place? So, you'll gather this information and you'll have a better understanding of some of the kinds of trauma they may have experienced, what triggers it. Do you kind of have a plan so that if a child is reminded of the trauma or is triggered in some way that, you understand some of the things that can help a child cope with that or de-escalate, and do you kind of have that plan in place and verbalized? Do you offer a continuum of appropriate trauma-informed interventions? How is that treatment intervention determined? Does it come from the assessment? Is there supervision from a trauma-informed supervisor? And how are those models trained and sustained? And a lot of this can be got at from interviews with administrators, looking at policies and procedures, surveying the staff who play a role in the process. But it's really important to talk to staff about it all as well, because the actual practice sometimes differs from the kind of practice that's laid out in a policy or in a program description. And then focus groups with clients and parents regarding their perception of the processes and the impact is also important. They may not know that they're getting a trauma-focused intervention, and they may not be. So it's really important to look at all of those factors. Next slide, please. So that was obviously a giant bucket that takes a long time, and it's really important to get a person who's really understands a lot of the trauma-informed treatments that are available and can help to find those really good matches for the agency's population, the clinicians that are there, or if it's not a clinical agency, for how to find those right resources in the community so that the child can be directed towards the best treatment in the family. So then the next domain I'm going to talk about is strengthening the resilience and protective factors of children and families. And, we try to involve youth and families as much as we can. And when we ask them what helps them, certainly lots of them talk about their therapist. But more so, they talk about the person at their church who is a, volunteer who, called them 3 days a week to go to the gym, or the coach who invited them to their house and showed them what a real family could look like. There may be, an after-school program. It's really important that that a mental health agency doesn't ignore. Just as it's important for a community agency to understand the importance of mental health and really good mental health treatment, it's important for a mental health agency to support and build up and encourage some of these practices that really build resilience. So how do those programs support peer support with families so that they can build some support networks? Outreach to other caregivers. It might be fathers, it might be you have to broaden our what we think of as family, because we know how vital it is to have a caring adult who can be protective and who can be a good role model and mentor to youth, even if it's not a biological parent. Do they have family strength tools or assessments of family strength? Do they advocate for the family and the other systems that the family is involved with? What kind of work is done around strengthening the parent or caregiver and child bond, around parenting skills, community connections? Are they connected to other things in the communities, maybe in a religious affiliation, other community-based organizations, and how can you kind of strengthen some of those connections? Because those are people they can talk to 7 days a week a lot of times. How do they identify family stress, and what do they do about it? Do they help to address some of the concrete needs of families? What skills do they teach related to social emotional competence? And this is something you can look at in a school system and all sorts of different agencies, because we know that children who have these skills do better and are more resilient when they're exposed to trauma. And then the sibling relationship absolutely should not be ignored, even though it often is, because that's another thing that we know, kids with siblings and strong relationships with their siblings are also more resilient. Next slide, please. We've kind of lumped a few things here under trauma competence and awareness, and this is where we look at what kind of trainings do people received, and this is staff at all levels, and that's extremely important. It is the, receptionists, it's the people in the cafeteria, it's the people in the janitorial staff. Everybody really needs to understand how trauma impacts families, how children and families might be reminded of traumas, and some skills based on their role that they might be able to do to create an environment that is most helpful. What kind of resources do they have for kids and families related to trauma to help them understand how it might impact them? This would also include an environmental scan, and this can be done. It's important to walk through the programs as a family would walk through them. Does the physical environment promote physical and psychological safety? Is this a place that people can feel safe? If you can replicate a client's experience as much as possible and take note of those touchstones, those people like that receptionist who is very, very welcoming to everybody who walks in the door makes a huge difference. And when you don't have that, that also makes a huge difference and makes people not want to come back, or can, be a reminder of other negative experiences that people have had when they've been re-traumatized by some of the systems involved in their life. So it's really important to pay attention to all of those, everything that a family, everyone they interact with, the things that they see, and that's broadly. We recently did a webinar on working with gay, lesbian, bisexual, transgender youth, and we talked about bathrooms. And if you're going to see transgender clients, then having a bathroom that they're comfortable going in, that makes them feel welcomed and safe, that is important. And that might not be true if you only have a women's bathroom and a men's bathroom, for example. Next slide. I'm talking more than I intended. I'll try to be a little bit quicker. But this is one area that I feel like is one of the largest opportunities for growth, at least with the organizations that we've worked with in our network. It's addressing parent and caregiver trauma. Are staff aware of birth-parent trauma histories, of the intergenerational cycles of abuse, the relationship between trauma and mental health problems and substance abuse, cultural issues that can impact disclosure of parent trauma, and treatment seeking, how domestic violence affects parenting behaviors, how a trauma history can affect a parent's response to professionals in various systems, and responses to some of the mandates in those systems, child welfare, juvenile justice, etc. Are there assessments that the agency does that includes measures to assess birth-parent trauma? What does the treatment of parents look like with parents who have trauma histories? How is it accessed? Is it general mental health treatment? Do you have trauma-focused treatment in your own agency, or is it easily accessible in the community? Are there strong linkages so that you're not just giving a name and a phone number to a parent if you believe that they could use help addressing their trauma? Do the staff who work with parents, can they identify what parents might need trauma-focused therapy? Are they knowledgeable about different trauma-informed treatment models that are available for adults? Are they knowledgeable about treatment models that address trauma and co-occurring disorders? So a lot of our agencies only see children, and so that's something that we're really working on, is how to have a really meaningful connection. Maybe some of them are able to provide adult treatments for trauma within their agency, and some of them just can't, and so they need to find community partners and funding sources so that they can have really integrated, connected treatment, working on common goals, but that's a space that's not just about how a parent can help a child, but it is also addressing the underlying trauma that's really impacting the ability to parent. Next slide, please. Continuity of care and collaboration across systems. This is really something to look at 2 levels. One is the individual and the family. So how can your agency really bring in all of the people that are important and involved in this family's life to coordinate care and work towards a common goal? And we give lip service to this a lot, but what a huge impact to have 5 people who are all involved, maybe a caseworker, a therapist, a case manager, probation officer, whoever it is, people really involved with the child's life. If they can sit down and put the pieces together with the family, understand the issues and work towards the common goals, that can just have a really huge impact on creating a more coordinated care for the family. And that also needs to be looked at the organization and system level. Do they have opportunities for cross-training amongst different professionals? Or do they maybe have somebody co-located? So, for example, a Department of Mental Health may have a clinician co-located in a child welfare agency. A child advocacy center may have a lot of these attorneys and detectives and child advocates and clinicians in one building, which greatly increases opportunities for collaborating and for understanding a family. Also, there's things like data systems for sharing information, and there are a lot of data systems available that allow you to not share confidential information, but to share other kinds of information, which allows for much better understanding and collaboration between the different systems, and reduces, for example, the amount of time a child has to have an assessment and be asked the same questions over and over again. And there's a lot of really great tools for helping systems communicate with each other. This is something that I think is one of our strengths at the network. For example, we have a bench card for judges, and one of the bench cards is specifically about how to order a trauma-informed assessment. And what our judges do is they copy it and they give it to the mental health practitioner, and it says, this is exactly the kind of information that I need to know about the child's trauma history that will help me make a decision about, what to do, where to place the child, what kind of things to order. And so it really helps these systems communicate, because it kind of cuts through all that, wait, I shouldn't tell you that, but I want to tell you this, I don't know what kind of information you want. And there's a lot of different kinds of tools, between systems that can help increase collaboration. Next slide, please. Finally, the last domain, and like I said before, should not be last, because staff who are traumatized cannot help families who are traumatized. If they're burned out, if they're disconnected, in this slide, the Wolf is saying moon schmoon, whatever, when we're in that stage, you are not really able to attend to a family and pay attention and identify, how you can help. So it's really important that an agency recognize the impact of working with trauma survivors on staff, has a deep understanding of secondary trauma. And I have to say that's often primary trauma, because a lot of our staff, if you're working in a juvenile justice facility, if you're working in child welfare, or in mental health, sometimes you're experiencing traumatic situations firsthand, and that can greatly impede your ability to do your work. And this is more than encouraging self-care. It's an agency needs to take responsibility itself for, creating practices that are less likely to lead to burnout. And this can seem impossible, when it's about reducing caseloads, when it's about really good supervision for everybody at all levels who has any direct care responsibilities, and it's creating a culture that doesn't value working 80 hours a week and ignoring personal life and not taking vacation, and but creating a culture that values that and understands how it's absolutely essential to this work. I'm going to stop there and turn it over so you get to hear a little bit more from Bree.
Great, and I actually just wanted to chime in and let you know we're coming up on 45 minutes into the webinar, and we actually have a couple of questions that I think would be really good for this transition. There's a couple for you, Jane, and there's one for Bree. So the questions for Jane are, how can I locate a bench card mentioned for our judge?
It's a great question. So on our webpage, the NCTSN.org, there's a couple different ways. You can go to products and search bench cards, and it would go, there's a tab for products, or you can go to our juvenile justice page, and there would be a link there. Additionally, if you're really interested in that JJ work, on our Learning Center, we have a trauma-informed juvenile justice resource site, and that has those bench cards as well as 10 things judges need to know about trauma, and a lot of other really phenomenal resources for that system.
Great. And is there a specific definition for a multidisciplinary team that shows the required staff that might need to consist of the team?
That's a good question too. I think that varies depending, in a mental health agency, that might be psychiatry and case management and, clinician versus at a child advocacy center that might be, a district attorney and detectives and, so it really kind of depends on the type of agency and the type of work you're doing. But if you have anything more specific, you'll get my email as well. There's some literature on what makes effective teams, so it kind of depends on your population, your goals, your outcomes.
Great. And Bree and Jane, you probably could speak to this too, but the question that seems to be a nice lead into Youth M.O.V.E. is actually from a youth who works with another youth, and she's asking, how should I handle it if another youth is accidentally triggered?
That is an excellent question, and it's a wonderful lead-in to some of the work that Youth M.O.V.E. National has been working on. I think what is really important is that currently right now in our system, we provide wonderful, great clinical intervention, and we're starting to talk more about trauma. But we're talking more about it in a little bit of an insular conversation, meaning within treatment, within a particular agency, and it hasn't necessarily been brought out into a community setting where we start talking about it and educating young people about it. So I think as I go through some of my slides, I might answer that question in a little bit more detail for you, and then we have some resources that Youth M.O.V.E. National is working on that are actual guides that will help you through those challenging conversations and thinking about developing personal wellness plans outside of clinical treatment. So Youth M.O.V.E. National, again, we're strong believers that young adults can participate in this creation and this exploration and preparation that Jane mentioned earlier about creating trauma-informed organizations. The first role to really doing that is to think of your cross-disciplinary team, and do you have young adult representation on that team? If you don't have young adult representation on that team directly, do you have a youth group or a young adult organization such as the Youth M.O.V.E. chapter that you can tap into to gain their insight about what it is like participating in that system, being a member of services at an agency from that trauma perspective? Another thing that we really need to do is we need to bring the conversations out into youth groups and into community settings. We need to provide education about trauma, its impacts, and we need to support ongoing learning opportunities for young people. We need to ask them questions. They are experts within their own circumstances. They know what works for them, what doesn't work for them, what they've tried in the past, why things might have been successful, why things may not have been successful, and how that information is all part of that exploration phase mentioned earlier in the presentation. And if we don't explore that and engage in conversations with them, then we're really only having a one-sided conversation about what this trauma-informed system or organization should look like. So we are strong partners in encouraging young people to be a part of each one of those phases. When you're thinking about the development of an organizational assessment or some sort of kind of assessing your needs and kind of where you're at and where you want to go, once you're able to implement your organizational assessment or a new trauma-informed strategy within your organization, looking at quality assurance, how did that work? Doing plan, do, study, acts, and having young people offer you feedback in that as well. So it's really important, and young people are very honest. They will tell you straight up how it's working and how it's not working. But they're also really good at providing solutions. So if something's not working, they're really quick to say, it would have been better if you did this. Or I think I would have been more successful if I had A, B, and C in place. But sometimes when they don't have an opportunity to really engage in conversation, no one asks the right questions, so they don't offer up solutions. When we think at Youth M.O.V.E. National, we think of the impact of trauma and trauma-informed care, we think bigger than just clinical. We think that clinical is definitely a huge element of healing and recovery and wellness, but we also think about it in all of our relationships and all of the service settings that young people might be a part of. So Jane mentioned the courtrooms and child advocacy organizations. Having this common language of trauma and trauma-informed care can help a young person go from one agency to another and have a sense of common language to utilize, and that each collaborative system is coming at it at the same. They all understand trauma in the same way, and they work with the youth and family in a way that's a bit more universal, precautionary kind of approach. If you could move to the next slide. So understanding trauma from a youth perspective a lot of our learning about our experiences happen outside of agencies. We learn the right way and the wrong way of how things happen in our life, unfortunately, through our personal experiences, and those aren't always positive. Young people, and this was something it personally took me a very long time. I grew up in a family with a lot of domestic violence, and I didn't understand the domestic violence cycle. No one really explained that to me, so I didn't have language to really articulate what was happening in my home. I thought things that were happening in my home were normal, that this is just how things were. So it took me a long time, and my mom was hesitant of accessing services in fear that systems would get involved and us children would be pulled or something would break up the family. And so we were not always accessing services as appropriate. So I didn't make sense of my world until I was much older. And so there was my life kind of how I come to know my world is based on those experiences. So there's kind of like this pre-trauma, what life was like before, and then once I was able to actually name it and call it for what it was, there's kind of my life post-trauma, which is more of an awareness, just like understanding coping and strategies and understanding my own triggers and things like that. But we have to work with young people to help them make sense of that world. I think trauma, and we're learning this from young people across the country, whether they acknowledge and say, I've been traumatized or I'm a trauma survivor, what we're realizing is complex stress and trauma minimizes one's ability to connect. And connection can be seen both as a risk factor and a protective factor. Young people seek out connection, and oftentimes we see that they may be seeking out connection, which is a risk factor because they're seeking out poor peer connections, and they're getting involved in gang violence. They're meeting that need for connection in a very unhealthy way. So really looking at how can we make connection a positive protective element for young people is really important as part of the healing. Connection, I think, when we think of engagement, whether it's engagement in services, connecting back to family, there's kind of this pre and post. And one of the #1 strategies that I've heard from young people who have experienced trauma is that their coping strategy is to withdraw. They disengage. That is their protective factor. If I separate myself from the world, I will be safe because I'm in control. And so if we want young people to truly heal and feel a part of something and build connection, we have to help them feel heard. We have to help them regain a sense of control of aspects of their life that they may have felt that they have lost control in. And we need to make them feel connected. And often, connection doesn't happen until they feel safe psychologically and physically safe, as well as being able to establish trusting relationships with others. So it's really important. Young people often say that trust is the hardest principle, the hardest element to gain in a relationship, but it's also the easiest to lose. And I think there's a lot of truth within that statement. And so we can't take a young person's trust for granted, that just because they're coming and seeking services at our agency that they automatically trust us. I think we really have to work at nurturing and building that trust and building that engagement so that they feel connected and safe in order to truly open up and do the tough work that they need to do to truly heal from their trauma. If you can move to the next slide. So trauma-informed organizations, again, this is all levels of your organization. So I know we talk about intervention and assessment and screening, but really understanding the impact of the story, shifting your approach from what is wrong with you, which is a very blaming and shaming approach, to kind of what has happened, kind of helps open up the dialogue to thinking about the situation differently. Understanding one's worldview and perceptions may be different for each family member. Oftentimes with young people, their sibling groups can experience the same situation, but yet each one is responding to that situation and to that trauma very different. And so sometimes we hear young people say, well, my brother got over it and he makes it look so easy, but how come I can't? And so really helping them understand that their feelings and their emotions are theirs, and how they're processing that is okay, and not having, and educating parents not to do the your brother got over it, you should too kind of thing, so that way we can meet the needs of both. We need to understand our bias as providers as well. We often hear with young people that the providers themselves, because of lack of trust or because of provider bias, that they're not even willing to open up completely. So they just shut down within treatment or within services. And then again, we talked a lot about providing trauma-specific interventions. And I think providing trauma-specific interventions is wonderful. What's even better is marketing those interventions to youth and families. Trauma-focused cognitive behavioral therapy is a model that I participated with the network in years ago, and I participated in that not as a client, but as a young adult consumer on how would I market this to other youth and families. When you say, hey, you have to go to mental health treatment, a lot of times young people don't want to go because they don't want to sit in therapy for a long time. So when you can educate them about the treatment model, what the treatment, what to expect when you get there, really helps kind of make them feel a little bit more kind of in the know and sense of control over what might treatment or what might therapy look like. So really looking at providing some really great education to youth and families about those interventions might help them connect to the intervention versus just kind of saying, oh, we have this great treatment, you should show up to this agency and we'll match you with somebody through assessment and intake process. We'll move on to the next slide. Again, providing the education, I think this goes back to the question that was asked earlier, is we need to provide education to everyone within the system, not just those that have the appropriate credentials behind their name, but we need to provide training and education to the youth and the family members that they can help educate other youth and family members, the receptionists, the janitorial staff, really providing education to everyone about kind of what does the impact of trauma have, what does that mean for them as a family. It helps them understand themselves better and allows them to understand their triggers and the lasting impact. So one of the things that Youth M.O.V.E. National has been doing is we have what is called What Helps, What Harms policy initiative. So what we've been working with is our chapter network. We have implemented this program, which is really an exploration kind of program about looking at each service system, so child welfare, juvenile justice, education, mental health, asking them what helps in the system and what do you feel as a recipient of services, what is harmful in the system. And when we're able to identify kind of the pros and cons of each system, we're able to then create responsive solutions, which helps the system shift and create change. And so we have created this national policy initiative, and you guys can get information if your state currently has a chapter that participated in the What Helps, What Harms project. They conducted youth groups within the communities asking a series of questions. They looked at each one of those service systems, and some identified domains and themes came up nationwide, and those are issues that Youth M.O.V.E. National is looking to continue to move forward. And a theme that consistently went through each system is the sense of creating safety and empowerment and really elements of what we see within trauma-informed organizations. So trauma-informed organizations really shift from a reactive and punitive structure to one that's proactive and prevention. So that's a great way that youth groups and youth advocacy organizations can really participate, because if an agency is not able to create programming that's more at a prevention level, youth groups are able to do some of that work in partnership with you. and then understanding the risk factors. So we continue to create several resources at the national level and partner with other technical assistance centers such as Georgetown University to create materials. And one of the materials that we're working on is actually a trauma and resiliency guide for young people, which helps you make connections about your personal experiences, how those experiences may or may not trigger you, and what do you do? How do you develop a wellness plan? How do you work through that? What strategies can you employ? And many of those strategies that we have in tips and resources actually are coming to us in the use of technology and multimedia and utilizing different apps to help with mindfulness and things like that. And so we have been trying to bring this trauma language down to a level that's more community-oriented so that there's not a stigma associated with talking about trauma. But we can look at it really as a healing process. So I think time-wise, should we go on to giving an example, John, or do we have questions?
Yeah, I was actually just about to chime in. We're about an hour.
Okay. That's what I thought. I kind of rushed.
Yeah, well, no, that's okay. I think an example would be in order. If everyone else is cool with us hanging out for another 10 or 15 minutes, we can definitely do that. We don't have any additional questions at this time, so if you do have any that are on your mind, please feel free to ask them. We'll be going on for about another 10 or 15 minutes here.
Great. So I'm going to utilize an example. When I started doing this work about 10 years ago, within my community, I was a young adult who had, as I mentioned before, experienced my own challenges in my childhood. I moved away for a period of time, and after college decided to move back to my hometown, and I took a job working within a system of care. And the system of care's focus was to be trauma-informed as a system. So they were assessing individual organizations. They were looking at new interventions to bring, and I was a part of that process right from the very beginning. So I'm going to really talk about the early years of Maine's work and then talk a little bit about where Maine is now, and then you guys can get connected to learn more about some of their work. So as the youth coordinator who facilitated a youth group, this idea of organizational assessment for us, it actually came out of a youth group. We had our state behavioral health division, we had community-based mental health providers, youth and families, and we were talking about the grant and what we could do and how would we know we've become trauma-informed and what that looks like and all of this. And we had a young person who had grown up in child welfare and spent a lot of time in residential. And he asked if he could be a secret shopper. He wanted to go into agencies, and he wanted to look at their physical space. He wanted to walk through his services and systems, and at the end of the day, he wanted to score the agency on how well they helped him in that session. And it was everything, and he used the word respect quite a bit. I want to know that when I walk in, I'm heard and I'm respected. And if not, how can we help young people feel heard and respected in future interactions at agencies? And so that got us really kind of thinking about how we would craft some questions that we would ask young people on an ongoing basis about kind of the organization as a whole. We also had youth and families that participated in the screening, assessment, and intervention selection period. So we had young people that were actively involved in a clinical group where we did a lot of review of different trauma interventions. We had kind of a score sheet. They read some research articles about the evidence behind each intervention, and they kind of had this little checkbox of like, well, it has this element, it has this element, and it has that element, and we like that it has 8 out of the 10 elements that we think a good intervention should have. So they really helped us pick the particular intervention. When it came to screening, we had several trauma screening tools that we looked at, and we worked with some national consultants to help us kind of pull that together. And we thought that was going to be an easy task because we just thought, oh, there's going to be a small handful of questions we'd ask young people
these questions that, they're contacted with the intake before scheduling an appointment, and then it's going to screen, and then we'll do a more in-depth assessment. And what we found out is young people, because there was no engagement and because there was no trust with the person doing the screening, that they would not be honest with the screen, which kind of threw us for a loop. And so we had to shift our practice a little bit. And what the young people came up and said was, in our community, one of the examples was kind of the adverse childhood experience screen. So you ask these 10 questions, and the young people said, well, show me the 10 questions, and I'm going to tell you I have 6 out of the 10, but I'm not going to tell you what 6 I have because I don't know you. But I will tell you I've had some, but you don't need to know which ones. And so that in itself was enough of a screen that then kind of carried over into a much more in-depth assessment. And that was a way that young people felt that they could be open and honest, considering they might have been sitting with a stranger that they've never met before. So it was a way to help them be a little bit more upfront without any fear in that process. We had young youth that partnered on providing trauma-informed training to others, as well as family members. So we had each one of our cohorts or our systems that we trained, we had graduates of the child welfare system that came and spoke back to child welfare workers and those that were in juvenile justice. We worked with them to share their story in juvenile justice training. So everything was co-facilitated by a parent or a young person that had experienced trauma, that had been trained in trauma and trauma-informed care, that had received training on strategic sharing, and they were partnered with a clinical staff member. So everything was, you got both perspectives every time you went out to train, which was very insightful because you had the clinical expertise, but you also got that insider perspective of what it's like to ask for help for the first time, like what it's like to make that phone call at an agency to schedule your first appointment, and what's going to make sure that you get there from scheduling your appointment to actually going, like what needs to happen. And so it was very, very powerful for us early on in our grants. The next slide. So we talked a little bit about the interventions. Our youth, after we had created our assessment protocol, we actually trained youth to go out and do observations within organizations. So the State of Maine's Trauma-Informed Organizational Assessment asks administrators of staff, clinical team, kind of paraprofessional, secretarial staff, youth, and families a series of questions. When we originally piloted that work, we did sit-down interviews, and youth were a part of those interviews. Obviously, for sustainability, we turned it into an online assessment process. Self-care is incredibly important, so we did a lot of education to family members about their own trauma and that they have to take care of themselves in order to then be able to care for their children. And in that same process, youth were also educated about the impact of their parents' story. Many of the young people didn't know that their parents had also experienced trauma. So it really opened up a really cool dialogue between parent and child of understanding where each person is coming from. So, young people might blame their parent, but they don't understand why their parent reacted a certain way, and it's because of their own parents' trauma. And so that in itself did it opened up a lot of doors for family discussion, for a better sense of, now I get it, I understand where you're coming from, versus this blaming, shaming perspective that families and youth can sometimes do to one another. So the State of Maine embedded annual trauma-informed organizational assessments into annual behavioral health contracts, and there's a best practice organizational guide that breaks down different domains, that helps agencies kind of assess where they're at and what might you do to improve in that particular domain. And as I left Thrive in the work in Maine about a year ago, and when I left, my job was to support organizations in developing technical assistance plans in meeting this contract requirement. So a lot of the work I did was we had 50 agencies that would complete it on an annual basis, and then working with them to develop some sort of quality assurance plan to kind of shift practice over the year before they had to redo that as well. So we'll move it to the next slide.
Okay, and I just wanted to also chime in that we're about 5 minutes away from the end of the webinar, and we do have one question about getting is there a way to get the organizational guide that Bree just referenced?
Yes, so if you want to access, you would be able to get that through the thriveinitiative.org's website.
Okay.
And they have an online kind of learning portal. They have some information about their organizational guide, how it was developed, how it's implemented, and I believe you can get copies of the youth version, the family version, and the organizational version. And then you can download. You just have to, just like the National Child Traumatic Stress Network, in order to download the materials, you do have to create a user account to access them.
Great, thank you.
Yep.
Great. So in the last 5 minutes then, do we just want to quickly wrap up our example and then maybe move on to our other resources and give people contact references?
Absolutely. So I touched upon a little bit about Youth M.O.V.E. National's policy initiative of what helps, what harms. So as your organization or your state is kind of in your exploration phase of hearing from young people, looking up that document on our website might be a great starting place to kind of see which system and what did the young people in your community think of when they thought of improvements. Trauma-informed for a lot of organizations is expanding within their peer-to-peer programming. Again, it goes back to the question asked earlier about I'm helping a young person and what do I do when they're triggered. It's another whole workforce. Capacity building is making sure peers understand trauma-informed, how to manage triggers, and that really looks at what curriculums you might be utilizing for peer-to-peer programming. And then obviously the example that I gave for Maine and the Thrive Initiative, they're looking this new grant cycle that they have. They've created their organizational assessment that they utilized in all of those behavioral health contracts, and they have now kind of turned this assessment into a Department of Corrections juvenile service assessment that's done also on an annual basis. They have one for their residential youth detention facilities, and then they also have one for the communities. So I think if that is the system in which you're working in, connecting with the Thrive Initiative would be a great starting point on kind of looking at how they were able to implement an assessment unique to that particular system.
Great.
Okay, well, I'll just jump in and just generally say that there's a ton of resources available to do the kinds of work that we've talked about here. Briefly, staff training is one example of something that's important, and we have a resource parent curriculum, a training for juvenile justice frontline residential staff, child welfare worker trainings about substance abuse and trauma and how they're related. We have a pediatric toolkit for healthcare providers. We have tools for educators. So I'd love to tell you more about them. And also we can help connect you to a site maybe near your area or a site that really has expertise in one of these areas who might be able to, it's always more than a training, because we know that just a one-day training doesn't always do the trick. So most of these curricula have embedded practices and evaluations or assessment, really tools that can help to sustain the lessons of the trainings. Next slide. This one is about some of our resources related to secondary trauma. There are more coming. We're working on a bunch of other fact sheets, but I really like this one in the middle, the secondary traumatic stress, a fact sheet for child serving professionals. But in addition, one of our partners, one of our sites has created a whole handbook about reducing secondary trauma and child welfare staff. It's really a guide for administrators and how to create more resilient child welfare systems. And then we have a speaker series with some fantastic webinars available around secondary trauma. Some sites use them during a staff meeting, as a way to kind of start the conversation. And then the next slide, the last tool I'll just quickly mention goes along a lot with what Bree was saying, and she's worked with a collaborative group, I believe, that developed this Pathways to Partnership with Youth and Families. And I love a lot about this tool. I think it's a hidden gem, not used enough, but it contains a couple self-assessment tools. One is for clinicians to use in their daily practice to assess how they're engaging youth and families and how they could do it better. And then the second one is to assess the level that the program or organization is partnering with youth and families. But it also has a lot of strategies for how to build this into your program in a really meaningful, substantial way. So, and like I said, there's, if you want to go to the next slide, there's a lot of other resources on our website. These are some other tools. A lot of them are other assessment tools. Bree mentioned Thrive, which is a phenomenal one, and there's some other ones available here as well.
Great. And I just want to reassure everyone that we will have the slides posted on the Pathways RTC website so that you'll be able to click on all of these links and check them out instead of having to hurry and jot them down right now.
And I just also want to add to a lot of the resources that Jane just mentioned, a lot of the curriculums that are developed. Those are wonderful curriculums that if you could, as I mentioned earlier, kind of identifying a training team, there's wonderful opportunities in there for youth and families to contribute to the training content right directly from your community. And so I really encourage you that if you're looking to implement a training toolkit offered is to look at how you'd be able to incorporate your own local youth and family voice within that process. It's really impactful.
Great. And just for reference, we have our contact information here for both of our speakers today. There's Jane's, and here is Bree's. And let's see, we did have one question. What is the Pathways website address? And it's pathwaysrtc.pdx.edu. And I don't know if there's any other final words from our presenters.
I just would say good luck to you, and please, it can seem overwhelming, but we have so many people and tools that can help, so please don't hesitate to reach out, and we'll try to direct you to the right place.
Great. Thank you, Jane. And thank you too, Bree. I think that this was really informative. We did have chatted in some compliments to both of you on this webinar, so thank you very much. Again, all of these materials will be available from the Pathways website. That's pathwaysrtc.pdx.edu. And we hope that you'll be able to join us again for our next webinar. You can also find out upcoming webinars from our website as well. Bree and Jane, again, thank you. And I think it's time that we sign off.
Thanks, everyone.
Okay. Bye-bye now.